NGN NCLEX RN practice questions. Question 1. Set 1. A patient is hearing voices that say, "Kill yourself." What should the nurse ask first? How long have you heard these voices? Do you have a plan to carry this out? Why do you think the voices say that? Would you like some medication? Assessing for safety and a specific suicide plan is the priority when a patient reports command hallucinations. Question 2. Set 2. What is the antidote for heparin overdose? Vitamin K, protamine sulfate, naloxone, acetylcysteine. Protamine sulfate neutralizes the effects of heparin. Question 3. Set 3. Standard precautions apply to which of the following? Only patients with known infections. All patients regardless of diagnosis. Only patients in ICU. Only surgical patients. Standard precautions are used for all patients to prevent cross-contamination. Question 4. Set 4. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hematmesis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 5. Set 5. What is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 6. Set 6. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 7. Set 7. Which position is best for a patient receiving a tube feeding? Prone, supine, high Fowler's, left lateral. High Fowler's position prevents aspiration during enteral feeding. Question 8. Set 8. A patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 9. Set 9. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 10. Set 10. Which is a common side effect of radiation therapy to the head and neck? Diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 11. Set 11. Which lab value is elevated in acute pancreatitis? Serum amylase, BUN, hemoglobin, potassium. Serum amylase and lipase are significantly elevated in acute pancreatitis. Question 12. Set 12. Which breath sound is commonly heard in a patient with an acute asthma attack? Crackles, wheezing, rhonchi, pleural friction rub. Wheezing is caused by air passing through narrowed airways. Question 13. Set 13. A patient has a suspected fracture. What is the first priority? Administer pain medication, immobilize the limb, apply ice, obtain an X-ray. Immobilization prevents further tissue damage and reduces pain. Question 14. Set 14. Which insulin is considered rapid-acting? Lispro, NPH, Glargine, regular. Lispro, Humalog, is a rapid-acting insulin with an onset of 15 minutes. Question 15. Set 15. A patient with DKA has Kussmaul respirations. What is the physiological reason for this? To retain oxygen, to blow off CO2 and correct metabolic acidosis, to decrease blood pressure, to increase intracranial pressure. Kussmaul respirations are deep and rapid to compensate for acidosis by removing CO2. Question 16. Set 16. A pregnant woman is at 32 weeks gestation. Which sign should she report immediately? Leg cramps, blurred vision or headache, backache, frequent urination. Blurred vision and headaches are signs of preeclampsia. Question 17. Set 17. Which sign is a hallmark of pyloric stenosis in infants? Green diarrhea, projectile vomiting, steatorrhea, abdominal distension. Projectile vomiting after feeding is the classic sign of pyloric stenosis. Question 18. Set 18. Which condition is characterized by currant jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease? Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 19. Set 19. Which medication is used to treat a suspected opioid overdose? Naloxone, flumazenil, atropine, epinephrine. Naloxone, Narcan, is an opioid antagonist. Question 20. Set 20. HbA1c levels reflect glucose control over what period? 24 hours, 1 week, 3 months, 1 year. HbA1c measures the percentage of glycated hemoglobin over the 120-day lifespan of red blood cells.